Well, I think the president's getting an earful. I think we've got people well informed, basically finally getting to have a say of what should be done about health care and health care insurance. It's too bad that it's taken this long for the president to take the time to say, yeah, we ought to be listening to both sides. Frankly, sadly, I think that the Nancy Pelosi, Harry Reid, are going to fight strongly against doing this anymore because, frankly, you've got people like Dr. Colburn, who is now speaking directly to the American people, and he has got the bully pulpit. And I don't think the majority likes to allow the minorities in the Republican Party to have that, especially when they're as effective as people as Dr. Colburn. I think the atomic or the nuclear option is a really bad mistake for the Democrats to do. I think that they're going to have a problem in the Senate. Even with that, I think they've got major problems in the House. I know that there's a lot of moderate Democrats who now have really second thoughts of voting for this proposal, which is the Senate proposal. And I think that you've got Republicans who found reasons to vote with the Democrats before who will not this time. Sadly, I don't think most of them will be. I think the big one is the $54 billion plus of savings in tort reform. Anyone who's provided baseline service for health care or supervised it like I have knows you cannot provide cost-effective health care in this country until you address that issue. And it's interesting to see that the proponents of the health care bill keep talking about places like Canada and Europe and about how they're able to do things. But they don't mention that they also have a tort system that's much different than ours. And they would never support changing our tort system to reflect those that are like in England, which I think really kind of questions where they're going to go with this proposal. If they want a system like the British or the Canadians in healthcare, are they willing to get the lawyers out of the operating room? That's the challenge. I think you're going to see a reverse of what exactly you saw in the showing in Maryland. When the president came to the Republicans, I think just coming and being able to break even, he did well there. I think that the pundits are going to say the Republicans walked into the president's turf, was surrounded by the Democratic environment, and the Democrats did not come out looking as good as they thought they would. I think it's going to be that the Republicans walked into the president's house and actually gave broadside after broadside and matched him one for one. I think the president realizes that he could not filibuster with the members. Senators and congressmen of the Republican side reminded the president that both sides were supposed to be able to speak here. The president actually had to make a reference about asking for more time because he was the president, and he didn't get far with that. But I think the fact that a lot of people are going to say the Republicans did very well, but more importantly, that they laid out the facts of why the American people are against the proposal that's being pushed. More doctors could be, but you had a surgeon in there, actually a new surgeon in, and he articulated a position very well. I think we could have used more, but I have to say that the team we put in there was pretty good. There's some that I think that we need to draw on new blood. I think the big secret is that there's a lot of good people who are not always seen on television that need to be heard, and we ought to dig deeper into our team, pull out that talent about issues such as the healthcare issue. So I think there was more physicians could have been used, but that's a judgment call. A lot of people didn't want to participate, but I'm sure every doctor did. I think the biggest thing is talking to both sides. You know, Republicans, you got to be willing to put the insurance companies on notice, like we did yesterday, working with the Democrats on the issue. But now you have to say, okay, the Republicans took their step. Now, Democrats, what are you willing to do on tort reform that's substantive? Not a promise of someday we may get to it, but we have to have a substantive issue that addresses that very real issue. And I think the Republicans have taken the first step towards the Democrats. Now it's time for the Democrats to be willing to tell their buddies, the trial lawyers, sorry, you've got to ante up too.